welcome to our course video. I'm Alice.
I'm Keira.
I'm Dhwani.
Today we'll be talking about chemotherapy. In 1940s, people see the sun as a healer. As well, they believe that many infectious diseases were caused by bacteria, but however, some diseases were caused by virus, such as AIDS. And during 1940s, they were trying to distinguish the difference between bacteria and virus. As well, we think they will also develop a medication for both bacteria. The medication and society development in 1940s, which are penicillin being developed as antibiotic, and the invention of first vaccine that against leprosy in 1940s. This strain that can stimulate the nervous system was produced during 1942. Prevent venereal system by using sulfaterol was known in 1943. As well, in that time, the streptomycin was being invented, which is a kind of antibiotic that fights the bacteria's infections. Scott fever being treated by penicillin in 1944 successfully, and also discovery of some radio wave in 1946. Mumps vaccine being invented in 1947. Sidney Faber is a famous pathologist who discovered the chemotherapy and known as the father of it. He found that folic acid will stimulate the leukocyte cell growth and worsen the disease. He published his study in 1948, which showed that folic acid autologous will temporarily remission. The accurate on different leukemia in children. This observation made the chemotherapeutic agent used to treat the children and adult malignant effectively. As well, the JEMI found, which is the first overall pediatric oncology treatment center, and then and the Children's Central Research Foundation, which is renamed as Dana-Farber Cancer Stimulate, were both being founded under Sidney Faber leadership.
Chemotherapy is one of the modern treatments for many forms of cancer. To understand how chemotherapy works, you have to understand the process of the disease we call cancer. Cancer is a potentially life-threatening disease that affects over 13 million people a year. There are many different types of cancer, including lung and bowel. Cancer cells differentiate from normal cells in a number of different ways. Normal cells receive signals from the immune system on when to stop dividing. However, cancer cells are able to invade these signals. Thus, cancer cells continue growing and growing, which forms tumors. As cancer cells are able to evade the immune system is not able to kill and attack the damaged cells. There are several types of chemotherapy: curative, palliative, adjuvant, and neoadjuvant. Curative chemotherapy aims at killing all cancer cells and be a permanent cure. Adjuvant chemotherapy aims at killing cancer cells left in the body after surgery. Neoadjuvant chemotherapy is done before surgery, and it is used to shrink the tumor. Palliative chemotherapy is done when the patient has no other choices. It is only used to slow down the growth of cancer cells, but it cannot remove them. Apart from these types of chemotherapy, there are many variations of chemotherapy drugs, which are separated based on the structure and how they kill cancer cells. There are 4 main types of chemotherapy drugs. Alkylating agents are one of the first chemotherapy drugs, which act directly on the DNA, breaking the DNA and uncoiling it so that the cells cannot divide. Alkylating agents do not work well on fast-growing cancers, so they are often used on slow-growing cancers. Antimetabolites are another type of chemotherapy drug. They trick the cell by mimicking the nutrients the cell needs to grow, which ultimately causes the cell to starve to death. They work best during the duplication part of the cell's growth, S stage. Anti-tumor antibiotics uncoil the DNA and prevent RNA, which is needed for the cell's reproduction. Plant alkaloids are anti-tumor agents made from plants. They block the cell's ability to divide. Although chemotherapy is a very useful medical advancement which helps save many people's lives, it has many side effects and does not always work.
Moving on to chemotherapy's social consequences. Chemotherapy works in active cells in the body, cancer cells, and healthy cells are active. Consequences happen when chemotherapy destroys healthy cells. There are a few examples of consequences of traditional chemotherapy. Fatigue that can affect both physical and mental aspects. It causes different types of pains, like cramps all in the body, numbness in the toes, and pains due to nerve burning. And also, sexual and reproductive issues. The long-term side effects caused by some types of chemotherapy are that they might permanently cause damage in the kidneys, liver, heart, lungs, or the reproductive system. Unfortunately, there is always a fear for cancer survivors to get a cancer relapse, or also known as second cancer. Some consequences are serious that need to be treated. If you don't get side effects, it means your treatment is not working and your health is not being improved in general. Most side effects are short-term, while there are very few long-term effects. Chemotherapy is a significant medical advancement because most cancer patients depend on it. Chemotherapy can always be a backup or can always be a first option for a patient. It can always be a backup when other treatments fail to work, and it can also be a first option because it can make tumors shrink to make use of other treatments after it. Apparently, even if a new invention comes up or it is still used by itself or combined with other treatments, it will always be there and will be a big medical aspect in the future. The social consequences for a person going through chemotherapy include to get rest during the day if going out at night. Antisickness tablets should be taken before a meal if thought needed. Patients should avoid family or friends who have had infections like chickenpox. They should not take any live vaccines while going through chemo. It is safe for them to be around people who have had live vaccinations as injections. The patient can go off for a holiday if they want to enjoy it after a few weeks after the last treatment. Well, those are the consequences of chemotherapy. Thank you!